For years, you've been told one simple rule about blood pressure: 120 over 80 is perfect, that it's the gold standard, that lower is always better, and if you're over 65, you've probably heard it even more because doctors want to protect you from stroke and heart trouble. But here's what I need you to understand today, as clearly as possible. For many older adults, pushing blood pressure down too far can be dangerous. Not uncomfortable, dangerous. It can lead to dizziness when you stand, falls that break bones, hospital stays that steal your independence, and in some cases, a chain of events your family never recovers from. I'm Dr. Sarah Mitchell, and I'm speaking to you the way I would speak to my own parents or grandparents because you deserve the full truth, not a one size fits all number. Aging changes your body in real ways. Your blood vessels stiffen, your pressure sensors respond more slowly, and medicines can hit harder than they used to. That means a blood pressure that looks great on paper can sometimes leave your brain and body without enough steady blood flow, especially when you get out of bed, stand from a chair, or walk to the bathroom at night. Before we start, I'd love to know, where are you watching from today? Just drop your state or city in the comments below. It helps us feel like one community here, learning together and supporting one another. And if you have any natural health tips of your own, feel free to share those too. Someone else might really benefit from hearing what's worked for you. Point 1. Why blood pressure works differently in older adults. Let me explain something very important, and I want you to stay with me because this part helps everything else make sense. As we grow older, our bodies change in ways that don't always get talked about in a regular doctor's visit. One of the biggest changes happens inside your blood vessels. When you were younger, your arteries were soft and flexible, almost like a new garden hose. They could expand easily when your heart pumped blood and then gently relax again. That flexibility helped keep blood flowing smoothly to your brain, your heart, and your kidneys, even when you stood up quickly or moved around. But with age, those blood vessels slowly become stiffer. This is a normal aging process. It does not mean you did anything wrong. Years of living, breathing, eating, and simply being alive cause the artery walls to harden a bit. When arteries are stiff, they don't adjust as quickly to changes in position. So when you sit up in bed, stand from a chair, or get up in the middle of the night, your body needs a little more pressure to push blood up to your brain. Here's where the problem starts. If your blood pressure is pushed too low, especially toward that old perfect number of 120 over 80, your stiff blood vessels may not be able to deliver enough blood to your brain fast enough. The result is something many seniors quietly live with every day: lightheadedness, dizziness, a brief blackout feeling, or that sense that you need to grab onto something to steady yourself. Many people think this is just old age. It is not. Very often, it's a sign that blood pressure is too low for your aging body, not healthier. This is why lower is not always better after a certain age. Your brain still needs steady blood flow to keep you alert, balanced, and confident on your feet. When pressure drops too much, even for a few seconds, the risk of falls rises sharply. And at this stage of life, a fall is not a small event. It can change everything. That's why we must stop treating older bodies like younger ones and start respecting how aging truly works. Point 2. Why standing up can become dangerous when blood pressure is too low. Now I want to talk to you about something very specific that many older adults experience but rarely connect to blood pressure. That moment when you stand up and feel dizzy. The room spins for a second. Your vision dims. You feel unsteady and have to pause, hold the wall, or sit back down. Many people brush this off and say, "I just stood up too fast," or "This is part of getting older." I want you to hear me clearly. This is not something to ignore. Inside your body, you have natural pressure sensors that help control blood flow when you change positions. When you're younger, these sensors react quickly. You stand up, your heart speeds up slightly, your blood vessels tighten just enough, and blood keeps flowing to your brain. You don't even notice it happening. But as you age, these sensors become slower and less sensitive. They don't react as fast as they used to. This means that when you stand up, your blood pressure can drop suddenly before your body has time to correct it. If your blood pressure is already on the low side because of medications or aggressive treatment, that drop can be dramatic. Blood flow to the brain decreases for several seconds. That's when dizziness happens. That's when balance is lost, and that's when falls occur. This is called orthostatic hypotension, but you don't need to remember the name. What matters is understanding the risk. For an older adult, even a few seconds without enough blood flow to the brain is dangerous. A fall doesn't just cause bruises, it can mean broken hips, surgeries, hospital stays, and months of recovery. It can mean losing confidence in your body. It can mean needing help for things you used to do on your own. This is why protecting yourself from sudden blood pressure drops is just as important, sometimes more important, than lowering a number on a machine. Point 3. Why medications affect seniors more strongly than younger adults. Now let's talk about blood pressure medications, because this is where many problems quietly begin for older adults. Medicines that worked well for you 10 or 20 years ago may not work the same way today, and that is not your fault. It's biology. As we age, the organs that process medications, especially the kidneys and the liver, naturally slow down. This means drugs stay in your system longer and act more strongly than they once did. A dose that is considered standard for a 45 or 55-year-old can be too powerful for someone in their 70s or 80s. When that happens, blood pressure doesn't just come down a little. It can drop too far, especially during certain times of the day. Many seniors have acceptable readings while sitting quietly, but when they stand, walk, or wake up at night, their pressure falls sharply. This is why some people feel fine at the doctor's office but struggle at home. Another issue is multiple medications. Many older adults are taking more than one blood pressure pill, sometimes without realizing how strongly those medications work together. One drug lowers pressure, another removes fluid, another slows the heart. Each one may be appropriate on its own, but together they can push pressure too low. The body of a younger person often compensates, an older body often cannot. This is why symptoms matter so much. Fatigue that doesn't make sense, feeling washed out, trouble concentrating, needing to sit down after standing. These are not signs of weakness or aging poorly. Very often, they are signs that medications are lowering blood pressure more than your body can safely handle. Point 4. Why the risks change with age. This is one of the hardest truths for people to accept, especially if you've spent your whole life being careful about your health. When you are younger, the biggest danger from high blood pressure is what it does slowly, over many years. It can damage your heart, your kidneys, and your blood vessels. That's why doctors focus so strongly on lowering blood pressure in middle-aged adults. They are thinking long-term, 20 or 30 years ahead. But as you get older, the balance of risk changes. What matters most is not what might happen decades from now, but what could happen this year or even this month. For many seniors, the immediate danger of blood pressure being too low is greater than the long-term danger of it being slightly high. A fall caused by dizziness can change your life in seconds. A broken hip, a head injury, or even a serious bruise can lead to hospitalization, loss of strength, fear of movement, and a loss of independence that is very hard to recover from. This is why doctors who work closely with older adults think differently. They are not ignoring heart disease or stroke risk. They are weighing it against something just as serious, the risk of falling. For someone in their late 70s or 80s, a fall can start a chain reaction. Less movement, weaker muscles, more time sitting or lying down, more infections, and more hospital visits. Many families are shocked by how quickly this decline can happen. That is why perfect numbers on a chart don't always mean safety in real life. A blood pressure of 140/85 might look high on paper, but if it allows you to stand without dizziness, walk confidently, and live independently, it may actually be the safer choice for you. At this stage of life, protecting your balance, your strength, and your confidence is not ignoring your health. It is caring for your health. Point 5. What the research really shows about blood pressure in seniors. Now, I want to talk to you about research, but I promise to explain it in a simple, clear way because this information affects real lives, not just medical papers. For many years, blood pressure guidelines were created using studies done mostly on middle-aged adults, people in their 40s, 50s, and early 60s. These studies showed that lowering blood pressure reduced heart attacks and strokes, and that information was shared widely. Doctors were taught, lower is better. And for younger adults, that often makes sense. But here's what was missing. Older adults were not well represented in those studies. People in their late 70s and 80s, people with multiple health problems, people who were frail or who had diabetes, kidney disease, or past strokes. So doctors were applying rules meant for younger bodies to much older bodies, and that's where problems started. More recent research that actually followed adults over 75 found something very different. Seniors whose top blood pressure number stayed in a moderate range lived longer and had fewer serious problems than those whose pressure was pushed very low. When blood pressure was lowered too aggressively, seniors had more falls, more fainting episodes, more kidney issues, and a higher risk of death. On the other hand, very high blood pressure also carried risks, especially for stroke. The safest place, the place where seniors did best overall, was in the middle, not at the bottom. This research surprised many doctors, but when you think about how aging affects the body, it makes sense. Older brains and kidneys need steady blood flow. They don't tolerate sudden drops in pressure well. A slightly higher pressure can actually protect vital organs and help prevent dizziness and falls. The The most important lesson from this research is this: there is no single perfect blood pressure number for everyone over 65. The best number is the one that keeps you steady on your feet, clear in your thinking, and living your life with confidence. That's what the science now supports, and that's what you deserve to understand. Point six: why blood pressure targets must be personal, not one size fits all. Now, I want you to really hear this part because it may be the most important message of all. Two people can be the same age and still need very different blood pressure targets. This is where many older adults get confused and frustrated because they hear a number and think it applies to everyone their age. It doesn't. Your body, your health history, and how you feel day to day all matter. Some seniors are healthy, active, and strong. They walk regularly, think clearly, and have no major medical problems. Others may have diabetes, heart disease, kidney issues, or have already had a stroke. Some are steady on their feet, others are frail and unsteady. These differences completely change what blood pressure range is safest. For a healthy 70-year-old who feels good and has no dizziness, a slightly lower blood pressure might be fine. But for another 70-year-old who feels weak, lightheaded, or unsteady, that same number could be dangerous. The goal should never be to force your body into a number that makes you feel worse just because it looks good on a chart. This is why I always say how you feel matters just as much as what the machine says. If lowering your blood pressure leaves you tired, confused, dizzy, or afraid of standing up, that is not good treatment. Good treatment helps you live your life. It helps you move with confidence. It helps you stay independent. Doctors sometimes worry about being judged for allowing a higher blood pressure reading. That pressure can trickle down to patients. But the truth is, medicine is not about perfection. It's about balance. For older adults, the safest balance is often a blood pressure that is slightly higher but stable, rather than low and risky. Point seven: understanding the two blood pressure numbers and why the bottom one matters more than you think. Now, I want to clear up something that confuses many older adults. When you hear a blood pressure reading, you hear two numbers: the top number and the bottom number. Most of the time, all the attention goes to the top number. That's the systolic pressure. It's the pressure when your heart squeezes and pushes blood out. And yes, that number is important, especially as we age. But the bottom number, called the diastolic pressure, is just as important, sometimes even more important for seniors. This is the pressure when your heart relaxes between beats. That relaxing phase is when the heart itself gets its blood supply. It's also when steady blood flow to the brain is maintained. As people get older, the top number usually rises because blood vessels become stiffer. That is common and expected. But the bottom number often stays the same or even drops. This creates a wider gap between the two numbers. Many older adults have readings like 145 over 70 or 150 over 75. That may look strange if you're used to younger blood pressure patterns, but for seniors, it can be normal. Here's the danger. When doctors focus only on lowering the top number, the bottom number can fall too low. If your diastolic pressure drops below about 60, blood flow to the heart and brain can suffer. This can cause fatigue, chest discomfort, confusion, and dizziness. It can also increase fall risk. For older adults, it is often safer to accept a slightly higher top number if it keeps the bottom number in a healthy range. A steady diastolic pressure, ideally around 70 or higher, helps protect your heart and keeps your brain well supplied with blood. This balance is critical. Point 8: what happens to the brain and kidneys when blood pressure is too low. Now I want to talk about two organs that matter deeply to your independence and quality of life: your brain and your kidneys. These organs are especially sensitive to blood pressure, and as we age, they become less forgiving when pressure drops too low. Let's start with the brain. Your brain sits at the top of your body, and blood has to travel upward against gravity to reach it. In younger adults, this usually isn't a problem because blood vessels are flexible and the body adjusts quickly, but in older adults, those adjustments are slower. When blood pressure is pushed too low, the brain may not receive enough steady blood flow, especially when you stand, walk, or move around. This reduced blood flow doesn't always cause dramatic symptoms right away. Sometimes it shows up quietly: trouble concentrating, feeling foggy, slower thinking, or unusual fatigue. Many seniors assume this is just aging, but in many cases, it's the brain not getting the blood supply it needs. Over time, consistently low pressure may contribute to worsening memory and thinking problems. Some research suggests that very low blood pressure in later life may even increase the risk of cognitive decline. This doesn't mean high blood pressure is good, but it does mean too low is not safe either. Now let's talk about the kidneys. Your kidneys filter waste from your blood, and they need enough pressure to do that job properly. When blood pressure drops too low, kidney filtration can slow down. In older adults, whose kidney function may already be reduced, this can lead to sudden kidney problems. Some seniors develop kidney injury after aggressive blood pressure treatment, not because the kidneys are failing on their own, but because they are not receiving enough blood flow. This is why balance matters so much. Blood pressure needs to be low enough to protect against stroke, but high enough to nourish the brain and kidneys. When doctors focus only on lowering numbers without watching symptoms, this balance can be lost. Point 9. What blood pressure ranges are usually safer for older adults? Now, we're going to talk about numbers, but I want you to remember something important as I explain this. These are guiding ranges, not strict rules. They are meant to help you and your doctor make safer decisions together, not to force your body into a box. At this stage of life, safety, balance, and how you feel matter more than chasing a perfect looking number. For many adults between 65 and 75 years old who are generally healthy and active, a systolic blood pressure, the top number, somewhere around 130 to 140 is often a safe and reasonable range. This level usually provides enough pressure to keep blood flowing well to the brain and organs, while still protecting against long-term heart and stroke risk. The bottom number, the diastolic, ideally stays between 70 and 85. For adults between 75 and 85, even if they are doing fairly well, the body usually needs a bit more support. Blood vessels are stiffer, and balance systems are slower. In this group, many people do best with systolic pressure around 135 to 145, again with a diastolic between 70 and 85. This slightly higher range often reduces dizziness and lowers the risk of falls. For adults over 85 or for anyone who is frail, unsteady, or has had falls, safety becomes the top priority. In these cases, systolic pressure around 140 to 150 may actually be the safest range. Trying to push lower than this can increase fall risk and cause harm. Independence and confidence matter more than a textbook number. If you have diabetes, heart disease, or kidney disease, targets may be adjusted slightly lower, but still with caution. Even then, going too low can be dangerous if it causes symptoms or sudden drops when standing. Point 10. The one test. Every older adult should know: checking blood pressure. When you stand now, I want to give you something very practical, something you can actually use at home. This may be one of the most important things you learn from this entire discussion. It's a simple way to find out if your blood pressure is too low for you, even if the numbers look good when you're sitting down. This is called checking for a drop in blood pressure when standing, and it can explain dizziness, weakness, and falls. Here's how you do it. First, lie down on your bed or couch and rest quietly for about 5 minutes. Make sure you're relaxed, then check your blood pressure and write the numbers down. After that, stand up carefully. As soon as you're standing, check your blood pressure again. Don't wait several minutes. Check it right away while standing. Now compare the two readings. If the top number drops by more than 20 points or the bottom number drops by more than 10 points, that is a problem. For example, if your blood pressure is 135 over 80 while lying down and it drops to 105 over 68 when you stand, that is a significant drop. Even if 135 over 80 sounds fine, that big fall when standing means your brain is not getting steady blood flow. That puts you at risk for dizziness and falls. If you feel lightheaded, unsteady, or weak during this test, that's also important. Your body is giving you information. This does not mean you are weak. It means your blood pressure or medications may need adjustment. Many falls in older adults could be prevented if this simple test were done routinely. If you notice a big drop, do not panic, but do take it seriously. Write the numbers down and bring them to your doctor. This information helps your doctor treat you, not just a sitting blood pressure reading. Point 11. How to work with your doctor to find the right blood pressure for you. Now let's talk about what to do with all this information, because knowledge only helps if it leads to the right conversation and the right care. Many older adults feel uncomfortable questioning their doctor or bringing up concerns. They worry about being seen as difficult or ungrateful. I want you to let go of that fear. Asking questions about your blood pressure is not disrespectful. It is responsible. The first step is to track your blood pressure at home. Not once, not twice, but over time. Morning and evening readings for 1 to 2 weeks give a much clearer picture than a single reading in a clinic. Write them down. Bring that record with you to your appointment. This shows patterns, not just moments. The second step is to share your symptoms honestly. If you feel dizzy when standing, tired for no clear reason, foggy or unsteady, say it clearly. Do not downplay it. These symptoms matter just as much as numbers on a screen. A blood pressure that makes you feel unsafe is not a good blood pressure for you. The third step is to share your standing blood pressure results. Very few people do this, and it can change everything. When a doctor sees how much your pressure drops when you stand, it often explains symptoms that didn't make sense before. When you talk to your doctor, frame the conversation around safety and function. You can say something like, I'm worried about falling, or I don't feel steady since my medications were increased, or I feel better at slightly higher numbers. These are reasonable concerns. A good doctor will listen. If medication changes are needed, they should be done slowly, one adjustment at a time, then reassess. Blood pressure treatment in older adults is not a race, it's a careful balance. Point 12. Treating the person, not just the number. This is where everything comes together, and I want you to really take this in. Good medical care, especially at your age, is not about chasing numbers on a chart. It is about treating the person sitting in front of the doctor. That person is you. Your strength, your balance, your thinking, your comfort, and your ability to live independently all matter more than hitting a perfect blood pressure target. Many older adults feel like their doctor is only focused on lowering the number no matter how they feel. If that sounds familiar, you are not alone. Medicine has spent many years emphasizing targets and guidelines, and sometimes that makes doctors forget to ask the most important question: how are you feeling? A blood pressure that looks good but makes you dizzy, weak, or afraid to move is not helping you. It is hurting you. At this stage of life, success is being able to get out of bed without fear. It's walking to the kitchen without holding onto the wall. It's feeling clear headed enough to enjoy a conversation, read a book, or go out with family. Blood pressure treatment should support these things, not take them away. This doesn't mean ignoring high blood pressure completely. It means finding a safe middle ground, not too high, not too low, a range that protects your heart and brain while also protecting you from falls and loss of independence. For many seniors, that middle ground is slightly higher than what younger adults are told to aim for, and that's okay. Now, I want to leave you with one clear, steady message, something you can carry with you after this video ends. At your age, independence is health. Being able to stand, walk, think clearly, and move without fear matters just as much, sometimes more, than preventing a problem that may never happen years down the road. Blood pressure care should protect your life as you live it today, not just on paper. If you felt unheard, if you felt like your concerns were brushed aside because your numbers looked good, know this: your experience is valid. You deserve care that listens to you, not just a machine. Bring your questions, bring your home readings, bring your standing blood pressure results. Speak up for your balance, your strength, and your quality of life. You've worked hard your entire life to stay healthy. Now it's time to protect what matters most: your ability to live independently and confidently. That is the true goal of good blood pressure care at this stage of life.